and welcome to another edition of Daily Clout. This is Breeauna Sagdal, the Associate Editor. And today I have with me Luna Singer. Luna is joining us from Oregon. So Luna is going to be sharing her analysis with us and her opinion from her perspective on situations both abroad and domestically. We are opening the floor and making an accommodation for Luna. She has difficulty typing. So rather than write a piece for Daily Clout, we are doing a video interview with her. Luna, thank you so much for joining us. Please take it away.
Okay, so I would like to talk about something that I'm sure people have heard about nursing homes. Maybe you've heard about what happened in New York with all the deaths in the nursing homes. And by the way, there were 15,000 nursing home deaths. It turns out there were 12,000 more than that. So 27,000. But I'm going to start with what's going on in Europe and the UK. There have been enormous numbers of elderly people and disabled people who've died in care homes. They call them care homes there. We call them nursing homes here. And a lot of it is not because of COVID. It's because of the use of a drug called midazolam. Midazolam is used in lethal injections. It suppresses your respiratory system, okay? And in the UK, like we did, they put nursing home, people with COVID back in nursing homes. That was one thing they did. But the other thing they did is they did not let them out for any reason. And that happened all over Europe and Canada and in the United States. So they put them in homes. A lot of them they put back with coronavirus, but they were not allowed out if they had a heart attack, if they fell and broke their hip or anything. The 911 there, the ambulances were instructed not to take them, okay, for any health care at all. At the same time, the nurses were not provided with the protective equipment, with vents, or any of the things you would need to provide proper care. The other thing is a lot of nurses didn't go to work because they were afraid of the coronavirus. And so you had short staffing. So there was a deadly combination there. And even worse in the UK, it turned out in their pandemic plan, they had already said that anyone over 70 would not be given treatment in case of a pandemic. From the illness. And there are documents coming out, they've been leaked, demanded with freedom of information requests. And so a midazolam was used, but so was morphine. In the UK, it was midazolam. But then you have other countries, and I'll give you a list of those. And this is what I've been able to find out. I've heard people have mentioned, but I have articles specifically about these countries. So you have UK. And the other thing these countries did is switch everyone who was elderly or had learning disabilities or were disabled to a do not resuscitate status, even if they didn't request it. It was an automatic shift that happened in New York as well. Okay, so we had this happen in UK. We had it happen in Sweden, in Belgium, in Italy, Ireland, Scotland, Wales, France, and Spain. Okay, so basically Europe and the UK. And there's even an article that I was able to find in an Israeli publication saying basically that Europe has committed genocide against its elderly and the disabled. Okay.
Wow.
Now, in addition to that, when you have a situation where there's an order to lock down a facility, including mental institution, nursing home, or group homes, so no one can go in and no one can go out. Staff can, but nobody else. You do not know what's going on behind closed doors, okay? You don't have volunteers going in to help. In some cases in the United States, they didn't even let visiting doctors or podiatrists or any healthcare provider in, okay? And the Washington Post did a huge write-up about that. So a lot of these deaths, in addition to deliberate killing with midazolam and morphine, come from horrible neglect, starvation, dehydration, bed sores, falls, then the person doesn't heal and so forth, and not getting their insulin. So there's a lot of things that happened that were indirect deaths. However, I do believe that given the staffing in nursing homes, which is, by the way, just as underfunded in Canada and Europe and the UK as it is here in the United States, to not allow anyone in is a recipe for death. I've been in a nursing home, but I was able to assert myself. I'm not a 90-year-old, right, who had a stroke or who has Alzheimer's. I was in there, I couldn't move very well, but I could speak up. I'm younger, and they knew I'd be leaving, you know, God willing. So they had to be more accountable to me, but I was not in a nursing home during COVID. Okay. So we know about that. And this, I'm going to be discussing an analysis of this because I think there's more than just something going on related to death and killing. There's a shift going on right now. So the next thing is, let's talk about euthanasia. Okay. And so there are countries in Europe that allow euthanasia, like Sweden and the Netherlands, the Scandinavian countries. And then in the UK, they had something called the Liverpool Care Pathway. It was outlawed in 2014 because it was being misused. However, they put it back in 2020, and they called it the good death. Okay. And they call it end of life care. So what happens is, let's say you go to the hospital, they'll decide, okay, this is not worth it. We're putting you in end of life care. And what does that mean? That means they leave you in a room, they withdraw all food and water, and they let you die. They don't check on you. They don't move you around. They leave you there to rot. And it was outlawed because of the tremendous cruelty, but it's back. Okay.
Well, and who decides who, if I may just cut in here?
The Secretary of Health, Matt Hancock, who resigned recently because, well, he's a whole nother story. We don't need to get into Matt Hancock right now. It's like the doctor, okay, the person in the white coat that every country has, like one or two right now. We have Dr. Fauci, and the CDC in the UK they have something called SAGE, and so forth and so on. So they snuck back what's called the Liverpool Care Pathway. It's back again. And so we have all these deaths. And what's happening in America, we need to talk about very seriously. Because midazolam kind of, I know what it means. I know what it is, right? So I was reading up on this because I don't know why, but since the beginning, I've been compiling all this information, trying to put everything together. So I've been compiling information about technology, about the economy, about the disease, about people dying, about suicides, child abuse, all of this, right? And so there was an article, and I believe it's in some major publication, which I can't remember right now. I have it though. And it said that the public health experts are asking states that do lethal injection for their midazolam supplies because they want to help elderly people who have symptoms from long COVID, like dizziness or weakness, fatigue, things like this. They want to help them when they go on a vent to make the vent less painful. I mean, it was just ridiculous. We've been using vents for decades. I never heard they were painful before. And so I was like, midazolam, elderly, okay. And then there's a lot of advocates right now pushing for a law to be passed to expand the type of illness that people get put into, sorry, that people get put into palliative care for, which is another word for hospice. You know, it's palliative care just means keep someone comfortable, but don't give them treatment.
Okay. And this is not the first time in America's history that we've sort of had these policies before. In the 1960s, we had forced sterilization.
Yes.
You know,
Mhm.
people need to understand that this is not,
I'm gonna get to that too.
out-
We're gonna, there's a lot going on right now that is simply taking on a different shape. It's forms. So, but I wanted to talk about the palliative care aspect of it. So
well,
they were
and
talking
just,
about,
well,
Mhm.
excuse me, just one more
Sure,
point to that. This is why informed consent is so imperative, right? This is
absolutely.
why informed consent needs to be the cornerstone of all medical care. So sorry, go ahead.
We must have bodily sovereignty. Okay, that is our last boundary. We
Right.
have to have that. Once you take that away, you give up your life, and you can get, they could take it from you in many ways. That could be,
Mm.
well, all of them would be unpleasant, but there's varying degrees of unpleasantness. So when we talk about midazolam now here in the United States, public health experts, they always say expert, which is just this way to make people think, oh, I believe it. It's authoritative. Oh, it's true. You know, it gives it credence, which is, we should be very aware of public health experts, right? I believe Hitler had tons of them on his team. But in any case, so they were talking about palliative care for long COVID in the elderly. And again, these symptoms, dizziness, fatigue, I'm like, what? And then for other diseases, chronic diseases. And I thought, what does that mean? Chronic diseases. I have a disease called myasthenia gravis. I almost died. I'm doing a lot better, but I would be considered to have a chronic disease. There's a lot of chronic diseases out there. How far are they going to take it? And that's what we need to talk about. Is there, and then in Canada, they have euthanasia there is allowed, but they're expanding what they will allow in terms of quality of life, in terms of what they will allow euthanasia for. And it's expanded now to include mental illness, including treatable mental illness.
Wow.
And used to need 2 witnesses and a waiting period. Okay, so you say, I want this to happen. You need 2 witnesses, and then it would be, I don't remember, 90 days or something. Well, now, for certain illnesses, you need, well, for all of them, you only need 1 witness now, but for certain of them, you can have it done the same day. So someone could be having a very bad day, and I want to die. And boom, you're gone. Italy, which is shocking to me, Italy is a Catholic country, and they are now going to be allowing euthanasia. And that is really surprising because the Catholic Church is usually very against it. So they've got enough signatures to get it on the ballot. So there's some real problems here. And I would like to now step away from the actual physical killing, because that's what we're talking about when we're talking about injections. I'm not talking about, injections, I mean midazolam and morphine. And when we're talking about palliative care, which is really another word for no care, and euthanasia, and locking up people and they can't get out. For example, in Ontario, Canada, the nursing home residents still haven't been let out, and they're vaccinated and they're not allowed out of their rooms.
Oh my goodness. I did not realize that.
To me, this is a violation of the Geneva Convention. It's solitary confinement.
But it's happening on a global scale. Like, how do
Yes,
we?
it is.
Ah,
Because there's a global paradigm shift. I mean, there's a major paradigm shift going on right now. So now I would like to bring in the idea of children and what's happening to children. So we know masks suck. Okay, there's ample studies, including one at the National Institute of Health website, which I have, that goes through the 7 ways they're bad for you physically and the 7 ways they're bad for you psychologically, and that they're not effective. And I could give you the link to that as well. So we have children being masked. We have 2-year-olds being masked. And of course, this is very physically bad for them. But there's something else going on, and it's called structural mimetics. And mimetics are how you emotionally relate to people, okay? How you view relationships between individuals. So they know that when you put a mask on someone, you take a step away, you're more detached, right? You have less empathy. But when you start children doing that when they're 2, you actually hijack their brain and prevent them from making the little neuro connections that develop empathy. Okay.
oh, wow.
And because remember, a lot of this is not hardwired, but those first 3 years are crucial for personality development. And I think it's very interesting that they go for the 2-year-old, not the 4-year-old, because your personality develops until you're 3. Those are the formative years. And when you're 2, you start only seeing eyes, and you start having to be socially distanced and being taught everyone's a disease, you are going to drastically change the way those people interact with society, what they consider okay, not okay, how they relate, and how much compassion they have when they see suffering. And so what I think we're headed for here, and then the PCR tests, which are completely violating. And in my opinion, they're a form of torture. And now they're doing them on newborns. And there was a case in the UK where the parents didn't want them to do it to the newborn. And they said, well, that baby's not your property, it's ours. The state said this. And then they said, well, and the woman said, no, that baby's mine. And they said, well, if you don't let us give her PCR tests, we're sending, whatever they have there, Department of Human Services, you're going to be paying you a visit. And then you have cases where the parents are double vaccinated, but the baby's taken away for quarantine for 2 weeks, just in case. And there was a case here in Georgia where you had a couple, the mother was tested negative, the father tested positive. The father was not allowed to be in the room. After mother gave birth, she was forced to quarantine for 2 weeks and the baby was taken away. She was separated from her baby immediately.
Wow.
Okay, so what we're seeing right here is there's a lot going on with life and human relationships and how we value each other and how we view each other. So you have this, they call it a Vmean, and that means how you perceive each other. So we have the masking. We perceive each other as disease. We have the distancing. We cannot talk to each other. We have the killing, and it's accepted. It's okay. I mean, in Europe, these health departments were held, they were said, you did this to our elderly. And they said, well, we did the best we could. And that was it. No charges brought, no one fired. In the United States, just recently, the Department of Justice dropped the lawsuits in New York, Pennsylvania, New Jersey, and Michigan, which were the ones under investigation. They dropped the lawsuits. In my home state of Oregon, we put our COVID positive elderly in 2 facilities that are the 2 worst nursing homes in the state and have a history of multiple disciplinary actions. Our governor was questioned about that and she simply had nothing to say. Okay, so we need to talk about this because this is really important and we need to fight back. The vaccine mandates are very important. The vaccine passports are extremely important because we're talking about bodily sovereignty and we're talking about a central system of control, right? If you have that passport, it's digital, guys, and you can't get in anywhere if they turn it off. Okay. But I don't really want to go there. What I want to talk about is right now, what can we do to protect our most vulnerable? Because all I can think of is what can we do right now? So we need to do things like call your local nursing home. Find out if they let people visit. Find out if you can volunteer. Things like this. If you know anyone in a nursing home, call and see if you can visit them. Now in Oregon, you can make an appointment to visit. That is not up to snuff in my opinion, because like I said, I've been in one, and if they know someone's coming to visit, they can kind of make things look okay. Maybe a couple days before, start feeding the person, bathe them, whatever. But it's better than it was before. If you know someone, ask around, hey, does anyone know someone in a nursing home? I'm going to visit them. Make sure they're okay. Call them, because I know from experience that if someone's coming around, a family member, a friend, they are nicer to that person. Okay. And the fact is, most people in nursing homes don't have anyone, and that's why they can kill them. And the same with group homes. We have not, you hear a lot about the elderly in New York, but no one's talking about the fact that group homes have also been locked down. And who knows what's going on in them. And also, I found something very interesting in the VAERS database, which is where the vaccine adverse effects are reported. For some reason, back in March, a disabled teenage girl was given a vaccine and she died. But we weren't supposed to be giving those to teenagers until June. So that is a very important thing to think about. So my analysis is,
did it specify if maybe she was part of one of the initial trial recipients?
Nope.
That's interesting. I remember when they first announced the phases of the rollout, the disabled were going to be the second phase. So there was going to be the elderly and the disabled. And there was such a tremendous amount of pushback because of the order and the way that it looked, obviously, that they ended up, changing that. But I just find that to be very interesting. I'd be curious to find more about the VAERS data.
I will send you that particular VAERS registration or whatever it's called. I will gladly say. Like I said, I don't know why. I feel like I'm preparing a legal case or something, because I have from the World Economic Forum. I've been putting together this huge dossier because I'm trying to understand it. And I don't think I could do much about it, but if you can understand something, then maybe you can do something about it. But I would
like you're here now, and that's doing something about it, and you're empowering others.
Right. So what we have right now is, if you look at the people, I don't like to say who's behind it, but if you look at what this one woman I like calls Mr. Global, who is sort of using this as an opportunity to shift things around to make the world according to what they like. I would argue that they view lives as disposable. I would argue that they would like to get rid of as many entities as they can because they want everything for themselves. I would argue that the way they view the world, which is through the lens of objects and machines, right? Bill Gates, for example, is a computer guy. They view it through the mechanistic idea, the fact that they're going to be replacing humans with robots. They even have ER doctor robots that can test for COVID and things like this. When you
70%, right? 70% of the human workforce is they're saying will be replaced by AI and robots by 2030.
Yeah, and one thing is, we can go on, the telemedicine thing is moving toward artificial intelligence for doctors. And that's why they allow it. Like, I'm on Medicare and I can get telemedicine covered now. But in any case, so when you have all these people who are replaceable, let's just get rid of them. Because the people in charge who are capable of masking 2-year-olds, who are capable of shutting down small businesses, locking people up, driving them to suicide, to overdosing, the domestic violence, the child abuse, the killing of the elderly and the disabled, the vaccinations, which, if you look at the VAERS database, which only, I believe there was a Harvard study, and I can send you that link if you need it, that only between 1% and 10% of the adverse effects are actually reported. So if you look at the most recent numbers of deaths caused by the vaccine, it's over 13,000. Any society, any government would just say, you have to take this, knowing that. And then it causes things like MS and myasthenia gravis, which I have, which is the more I move, the weaker I get. All these other things, and heart problems in young people. We're vaccinating the military. I mean, young men. That tells you the way they view life. And the way they view life is not life. The way they view life is useful or not. Okay, there's nothing new here. It's eugenics all over again. It's useless eaters all over again. It's Hitler all over again. And I'm Jewish. And I saw it from the beginning. The way that you say this is essential and this isn't for a business. Who's to determine what gets to live and what gets to die? This is the paradigm we're in now. We've shifted. Okay. And I want to warn people about that. I want you to think about that. When you feel scared, when you hear in the media, oh my God, the Delta variant, oh this, oh that, I better wear a mask. Remember something. When you wear that mask, you're dehumanizing us. You're reducing us to a disease that needs to be exterminated. We don't want to be conceived of as things that need to be exterminated, because that is a route you don't want to go. We're already down there. We're already headed there. We don't want to go any further. And I mean that. And from a selfish point of view, I'm disabled. Our president just put in tons of money for Social Security, not to get people on it, but to do full medical reviews. When you do a full medical review, you go over everything with a fine-tooth comb and you kick a lot of people off.
Wow.
Okay, so, and I also am very worried, by the way, that because I'm on Social Security and disability and Medicare, they're going to mandate the vaccine for me. But that's, again, how they value life. And that's what I wanted to talk about, is we mustn't forget what they're doing with this disease. The real death going on, it's not the virus. The people who've died in the nursing homes, it's not the virus that's killed them. It's the neglect. It's the isolation. And what we're doing to everyone, we're turning them into humanoids. You think about it, the masks, social distancing, all of this, we're being reduced. Total reduction of life. It's the total extermination, and the killing of the joy is also killing. They don't want us to have fun, go to coffee shops or anything, go have a party, kids in the playground. So you have to see what's going on, the big picture. They're trying to get rid of life. And I mean, elderly people have the wisdom and children have the joy. So who are they going after? Do you understand?
It's certainly feels that way. There are days I really have to get recentered myself, because I just feel like this outpouring of energy, and it's just, it feels like such an energetic attack. Or
it is, and it's a fundamental attack. What is life? Life is light, right? So when you take away that smile that brightens your whole face, right? When you take away the ability to be close to people, that's an energetic interaction. When you're close to someone, it's electricity. It absolutely is. We generate heat.
Yeah.
Right. You're taking away all of that. Think about what you're doing. And the cruelty is a whole nother point. It's, I hate to say this, but we're in the hands of genocidal maniacs. And people need to understand, Bill Gates is not your friend. He doesn't care about climate change. None of these people who go on TV and claim to care about you. And you can't expect a politician to save your life. You can ask them to help, but you can't expect it. You need to do it for yourself, and you need to think, what is something I could do concrete? And then you might want to educate yourself. I'm rereading Hannah Arendt, her book, Eichmann in Jerusalem, and her book, The Origins of Totalitarianism, because that tells you a lot about what's going on right now. And for me, I know that you feel all this outpouring. For me, I am up a lot, and I feel very upset when I think about the businesses and the children and the domestic violence. 3 of the children in my little complex have been removed because of child abuse, because they're home alone all the time with their parents. So I think about these things, and I think about all the people who go about their day not caring, all the politicians on Zoom, all of these people, and all I could think of is Hannah Arendt's term, the banality of evil, people who just follow orders. And we want to stop that. It's like I said, we're headed that way, but we've got to come together in person as much as possible. Because again, that energy is, you leave and you have more energy, and you come back and you get more. It's called the collective consciousness. We need that. So that's my telling the world, this is what's going on. We must stop it. And
so education, refueling, and then you recently worked with Senator Kim Thatcher in Oregon on a bill that everybody praised. I know I wrote about it in the media. I was very excited about it. And that was the stop the, or excuse me, pardon me, the ban for vaccine mandate bill.
Yes. And hopefully we get rid of the mask mandate. Yes.
Right. And that was in conjunction with Daily Clout and our 5 Freedoms campaign. Is that right? That's excellent.
The bad news is that it died in the House or whatever, but it's not over yet. Kate Brown has not yet come out with it, although my understanding, it's simply because Oregon's behind in the technology. Oregon's behind in everything. by the way. But there's still time to fight it. There are organizations, and I'll send you links as well. There's like Stand for Freedom, Restore Oregon. They're working on different aspects of this, but you know, we can maybe suggest to them, let's also add this to what we're working on. You could go to your local community and say, look, these vaccine mandates are discriminatory against people of color. And it's true, but it's also a good way to do it, because if you're dealing with Democrat districts, they're very responsive to that. They don't want to be called racist. Identity politics.
It really is. It is.
It's incredibly racist and ableist and everything else you could call it. So I want to tell you guys, you could go to your city council and say, hey, don't do this. This is racist. You know, start with things like that. I don't think you're going to be able to sit there and discuss with them the value of life or whatever. That's just go straight for this is racist, knock it off. Okay. That's what I would do. And try to see if there's areas in your community, people that you can connect with, groups, go online and look. I will send you links about all of this. And then good luck.
I would definitely like to put a plug in there for Oregonians for Medical Freedom. They've been on the front lines of fighting back since 2004. And let's see, you had mentioned Restore Oregon. That's a good group. But Stand for Health Freedom, that's another fantastic group that's been helping. Obviously Daily Clout, right? We've been working with people in all 50 states on our 5 Freedoms campaign, and Children's Health Defense, clearly.
Oh, of course,
and, yeah. And so there is a collective community, there is a collective consciousness to draw upon, right? And to become more centered. We have rallies and we have get-togethers, and we're constantly filling each other up with information from people such as yourself who are willing to collect it.
May I add one more thing you can do? And I do this. I have a printout of what the vaccine passport will turn into. It's an image, and I'll send it to you. I have that image, and then I write down a few things to watch. I give links and a few articles for people to read. And I go to everyone, my mailman, everyone I see, I say, if I go in the store, I'll say, hey, by the way, you hear about vaccine passports, this is what they're going to be. Da, 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 da. And I show them, and then I say, watch this, that, and the other, and I give it to them. And I say, pass it along. Because that's how you get the information out there, is if you give an image, a picture, and then, you know, some links, and say, please watch this and see this. I don't tell people this virus thing is nonsense. I say, look, it's being hijacked to further an agenda.
Right. Yes.
And people go, oh, even if you believe in that it's killing trillions of people, you can understand it's also being hijacked. I would like to share information. I know I have a lot of information that I'd like to get out there. And then if you have any, and if you know anyone locally I can meet with, so we can start going, because I'm kind of alone. My caregivers know, but they're not like really motivated like I am. I am a useless eater, but I also know the route we're going down, and I don't ever want to go down that route. So
sure, certainly. Well, Luna, thank you so much for your time with us. I really appreciate you.
Okay.
And